Europe. I'm Hans van der Velde, and in daily life, I am a coach. I coach employees for employers. Next to that, I'm a volunteer at the Dutch Association for ADHD and Dyslexia, and I'm in the board of ADHD Europe. This is Broadcasting ADHD Europe. Today, our team is shining a light on women, and we have three fantastic women here in the studio, and they will introduce themselves in a minute. That's Dora Wynchank, Sandra Coy, and Chantel Fouche. Before we start, I want to tell you that this will be streamed live. So when you put in questions in the Q&A, you can set questions in the Q&A, and I will manage them to propose them to the speakers. It will be seen by everybody. This is ADHD Awareness Month, so happy to have you on board. Welcome, Sandra, Chantel, and Dora. And of course, our colleague in the board, Viljo Building, who is moderating all this and making it possible. Fantastic. Today, it's about women and ADHD, ADD, health, hormones, cardiac health, etc. So please, can you introduce yourself? Let's start with Sandra.
Well, thank you, Hans. I'm Sandra Coy. I'm a professor on adult ADHD in Amsterdam University Medical Center, and I work as a clinician at incl in The Hague. And I've been doing this for the last 20 years. So I have a lot of clinical experience, and I'm highly dedicated to discover what's happening to women with ADHD currently, after first starting with ADHD in general in adults and ADHD in older people. Now we are addressing ADHD in women because it's about time. And why is it about time? Because women have been neglected in research and women have been neglected in clinical care, and we can do something about it together. And this is why we invite you to join us tonight. And Dora, my colleague who works with me, and Chantel, who is an excellent ADHD woman from ADHD Europe, will tell you all about our efforts to get this work done with your help and your input. So that's all about me for the moment. Thank you.
Dora?
Yes, Hans, thank you so much for the introduction. Viljo, for your support. My name is Dora Wynchank. I'm a psychiatrist. I'm originally from South Africa, but in fact I moved to the Netherlands because I was in awe of the work of Sandra Coy, and I did some research with her. She's been my mentor. She is dedicated to the field of adult ADHD. For myself, I'm working as a psychiatrist and a clinician with adults in the Netherlands and The Hague. I also work for the DIVA Foundation, which is a semi-structured interview for people all over the world to diagnose ADHD accurately. And I have recently had the honor to join ADHD Europe, and it's with great pleasure that I'll be addressing you tonight. So thank you.
Thank you, Dora. Chantel, can you introduce yourself? And then we can start with the talks. You have to unmute yourself.
I do apologize. First of all, I'd like to thank Hans for the lovely, warm introduction and for giving us the opportunity to speak tonight. So I live in Belgium. I am also South African. I'm a mother of two boys. My oldest is 19 and he was diagnosed at the age of 7. I was not diagnosed during my teens as having ADHD. I never knew that ADHD is hereditary until a conference in Belgium with Dr. Ellen Littman. She closed a lot of doors for me. I found support and information for my son from the Belgium organization that I volunteer for and I'm the Secretary General for. They called ADHD, ASC and LD Belgium. And as most of you know, I also volunteer for the ADHD Women Project, and I also volunteer for ADHD Europe on a European level with fantastic members all around Europe. And I'm happy to be here to talk about supporting and empowering women.
Okay, thank you, Chantel. There was a question if this is recorded. Yes, it will be recorded. It is live streamed to YouTube and Facebook, and it will be, you can find it there on Broadcasting ADHD Europe. Okay, Dora, go ahead. Shine a light on women with ADHD. Please do.
Thank you so much. Well, as I said, welcome to our new insights on health in women with ADHD. As Sandra mentioned, it's an area that has unfortunately been neglected in the research. So what I hope to do today in my introduction is to shine the spotlight on some new issues, some perplexing issues around the experience of women with ADHD. So in terms of conflicts of interest, I have none. As I mentioned to you, I'm working at incl, a psychiatric clinic, and as well have a connection to the Expertise Center ADHD. I work for the Diva Foundation and also have a connection, an active connection with ADHD Europe, who's bringing this broadcast to you tonight. Okay, so to start with something a little sobering, a little depressing perhaps, many women see their problem with disorganization as a character flaw. In other words, something that on the side of psychiatry and psychology and coaching, we see as ADHD, they see as a deficiency, as something wrong with them, something that they've been criticized about for many years. And this can have terrible consequences on their self-esteem. But luckily, there are women like Sari Solden who have been writing and talking about ADHD in women and the experience, which is quite different to that of men. So I'm going to be sharing some of these findings and questions with you in my introduction. What have we learned then about ADHD in girls and women over the last couple of years? Well, let me start by asking you a question. Do you think there are more girls or boys with ADHD? And it might sound like a simple question, and perhaps for some of you the answer is clear. When we talk about the prevalence, on average, 3 to 4 times more boys have the diagnosis. However, there's a caveat. It depends where you look for those boys. If you're looking at boys in the clinic, in the hospital, you'll have up to 9 times more ADHD in boys than in girls. So these are people who are ill enough to be presenting for help, to be seeking treatment. Something quite different happens when you look in the general population. These are people who may not even know they have the condition. Here, it's only 2 to 3 times higher in boys than girls. So already, this statistic is telling us something about who gets referred for help. And it certainly seems to be more boys than girls. So we can ask, well, why is this? In population samples, there seems to be less of a difference in the prevalence between girls and boys. What about women? Women with ADHD, are there more women or more men? And if this were a live kind of post-corona event, I would ask you to raise your hands or post something in the chat. But in terms of prevalence in women and men, interestingly, it's more or less 1-to-1. So something's happening. Either more women are developing ADHD or are being recognized as adults, or more men are in fact losing their symptoms and getting better. So what I can say to you is that for decades, ADHD was considered a condition of boys only. However, now girls are being increasingly diagnosed. Still, they may be missed. Who's going to miss them? It could be their teachers. There's a really fascinating study that was done where teachers were presented with little case studies of children who had very typical ADHD symptoms. When they changed the child's name and they used female pronouns like she and her, they found something really interesting. When boys' names were used, the same case was more likely to be referred for additional support and was considered by the teacher to be more suitable for treatment. With exactly the same symptoms, having a girl's name and a she or he created some kind of bias, and these teachers would not be as likely to refer for treatment. This is also true of parents. Parents will tend to underestimate the impairment and severity in their girl children, so somehow they also possess this bias, and they will overrate the same symptoms if they are occurring in boys. So this is telling us something about the prejudice in our society, and these have been studied. So the research is telling us about interesting sociocultural biases. These differences may lead to the perception that girls with ADHD are less impaired because their severity of symptoms is being underestimated, and they're not likely to be sent for treatment or diagnosis. Now, what about girls compensating more? That is true. The research tells us that girls tend to be more adaptive socially, they tend to be more compliant with instructions and resilient. They may use coping strategies to mask their behavior. And if they are so good at compensating, they are not going to get referred for treatment or for diagnosis. And again, these differences may lead to this perception that girls with ADHD are less impaired than boys. But I ask you, is this true? Where are these ADHD girls hiding then? Well, many are going to remain unidentified and untreated. And as you know from many previous talks that you've listened to, if you do not diagnose and treat ADHD, hopefully in childhood, there are all sorts of implications for you socially, in terms of your interpersonal relationships, educationally. A very bright person might not end up achieving what he or she could if diagnosed and treated. And thirdly, as you'll learn tonight, there are all sorts of health outcomes in the long term for women and men with untreated ADHD. Now, what is going on between men and women? What is the difference that we know so far from the research? We know that women can present with both types, inattentive and hyperactive impulsive symptoms. However, the symptom severity may be lower in girls and women. This was shown by some early meta-analyses that found lower severity of hyperactive impulsive symptoms, or even of all three ADHD symptoms in girls and women: inattention, hyperactivity, and impulsivity. But then you have to ask, where were these studies conducted? Where there was a clinic referral or diagnosis, one finds that there are in fact the combined subtypes for both girls and boys. So girls will have hyperactive impulsive symptoms. Where you're sampling in the community, you'll find more dreamy, distracted, inattentive ADD girls. So these are some findings from the research. Again, these differences may lead to this perception that women with ADHD are less impaired. Now, what's also fascinating from research is that women may in fact present later than men. They are more likely to present during a period of transition, for example, a new relationship, something changing socially for them, even educationally. In terms of what the difference is between women and men, we know from the research that when diagnosed, women tend to be older than men. And if you're an adult getting a diagnosis for the first time, as we heard from Chantel, you've got 55% more chance of being a woman. What's also quite sad is that the prescription of ADHD medication is lower in girls at women compared to boys and men. So these people are not getting treatment. And again, if you're missing these cases, then you might think it's not a problem in women. So what about symptoms in girls and women? What does the research tell us then? Are there different symptoms? And I'd like to explore this with you for a few minutes. Inattention in girls and women with ADHD can present with being easily distracted, disorganized, overwhelmed, lacking in effort and motivation. Now be careful here. I'm saying it can present as, but it can also be falsely viewed as poor effort or just no motivation, couldn't care. In a few minutes, I'm going to unpack these two last points that I've listed, because is it truly lacking in effort and motivation, or is it something else hiding behind that? So an ADHD girl will likely forget her belongings, misplace things, spend ages looking for those things. Homework will take just far too long. It takes longer. If you ask her classmates how long it's taking them, she will spend much longer because she's getting distracted very easily. And that could be internal sources of distraction, like her own thoughts. But of course, it could be screens. And with COVID, there's been so much online learning that people with ADHD have often, in fact, suffered. Furthermore, for these girls, their studying is not effective. The effort that they put into studying or to learning just does not produce the results. So the results don't match the effort. Often they'll have difficulty comprehending what they read because they are not focusing on what they read. Details will escape this girl and she will struggle to follow instructions. And if you don't read the question in an exam carefully and you don't follow the instructions, you might have a brilliant mind, but you're going to answer that question incorrectly and get marked down. Furthermore, ADHD girls may be brimming with creative ideas, but they cannot complete their projects. It's this follow through that's difficult. They might often be late. They might channel hyperactivity into sport. They might be unable to learn from the consequences. They might, as girls and teenagers, have major mood swings and what we call emotional lability, leading them to be misdiagnosed with another diagnosis like a borderline personality disorder. Socially, girls have a very hard time if they have ADHD because their relationships interpersonally will suffer. They battle to read social codes and to follow conversations. This might lead to conflicts, and in fact there's research to show that there are more conflicts between ADHD girls and their peers than non-ADHD girls and their peers. As a result of this, the entourage, the friendship group, will start to reject and isolate the ADHD girl, leading to all sorts of problems. In girls and women, ADHD can, as I said to you, present as lacking in effort or motivation. But in fact, from what I've said to you, it seems like they are not lacking in motivation, but they struggle to structure their organizing and their planning sufficiently to achieve the desired results. Okay, so what happens if your friendship group rejects you, or if you don't hand your projects in on time, or you're always late? Your self-esteem will be affected. This is low in girls and women with ADHD, with the result that anxiety and mood disorders are common. So-called internalizing comorbidities, the coexisting disorders tend to be inward, feeling bad about yourself, not lashing out. This anxiety and mood problem, if present, can persist into adulthood. And if it's present, it's another disadvantage for the woman with ADHD because it's clear that this woman is depressed. Clinicians will treat the depression and will miss the ADHD, unfortunately. So it'll obscure the underlying ADHD. So what factors influence ADHD in women, and how can we better understand it? And this is where I'm going to be shining the spotlight by introducing our next speaker, Sandra Coy, who's going to be giving you more details on research findings into very specific areas of women's health. But I also have a moment here to ask you if you have any questions, because I will be coming back to you at the end of the presentation to talk to you about another exciting project that's been launched jointly by ADHD Europe. But for the moment, do you have any questions? And Hans, I'm going to hand over to you. Perhaps you can run.
Yes, thank you. Well, while everybody's thinking about formulating a question for you, a question did come up that it might be very easy to think the way you describe it, at least in girls, at least in primary school, that when they cope so well their ADHD in their genes, why the worry and why should you diagnose them early? It was not totally clear. I understand that when they go to the secondary school or hit puberty or go study, etc., during life changes, then the problems will arise. But in primary school, some of them at least cope very well. So what's the problem then, and how can you diagnose when there's no problem? I say it a bit blunt, as you know, but
okay, so you're exaggerating the point to make the point. I understand.
Yeah.
So let me first say that in primary school, not every girl will compensate. It is possible for some girls to compensate and to be missed. But I think that the main reason that girls are missed is that children who are dreamy and inattentive will not be picked up by the radar of the class teacher. They will not be disruptive. So they might not be causing a problem in class, or they might be using some methods to compensate, but really they are no disturbance. The fact that they're sitting there quietly, but their minds are 100 miles away, means that they're not what is being taught. And therefore, even if their marks are kind of middling, they could be doing so much better. They are not achieving their own potential. So I think that's the first point. It's not so much about who causes a problem to teachers or who is disruptive or whether their marks are average because they can compensate, is what is that girl's innate ability and is she achieving it? That's important. And second of all, there is a lot of work, a lot of research that backs early diagnosis as a protective factor for later problems. For example, unemployment. So people who get early recognition and appropriate treatment will have less chance of developing all sorts of secondary issues like later difficulty with work, a lower academic level, drug use and cigarette smoking. There's a long list. I haven't got time to go into it, but there is a protective effect of early diagnosis.
Yes, of course. I do recognize that from the clients I see, women on later age as well as girls. And I think one of the most important damages that is done is their self-image, their self-confidence. And that starts really at primary school age. So thank you for there's a question here from someone called Purple. Can boys in this way present in the same way? My son doesn't get diagnosed because school don't see a problem, but at home we really do. I think you already explained it, but
just very briefly, according to DSM, yes, boys can compensate, especially high IQ boys can appear not to have ADHD because they're compensating by grasping things very quickly. And again, they may be underachieving for their own level. According to the DSM-5, you need to have symptoms in at least 2 areas. So if it only ever happens at home, then what you would, but nowhere else, not socially, not with friends, not in extramurals, not in school, you would ask some questions about that. But then you, of course, have to weigh in how much of a protective effect there is by other factors helping boys to compensate, like high IQ that I mentioned.
Yeah. So thank you so far. Christine, it says here, or they can be misdiagnosed and receive the wrong treatment. That's what you said. And then the damage starts to compilate. And that might be a nice bridge to Sandra. Sandra, if you can start about health in women related to hormones and cardiac health, etc.
Okay, thank you, Hans. Thank you, Dora. This was wonderful, really wonderful. Are you able to see my screen?
Yes, we can.
Okay, wonderful. I'll be talking about heart and hormones. I've been talking about hormones before, and this webinar also by ADHD Europe is on YouTube. You can watch it if you want. I will do a short summary on the hormones here and then add a new topic on the hearts of women with ADHD. There's no conflict of interest for me. Well, the hormones change every month, as we all know. Estrogen starts low in the beginning of the menstrual cycle. It peaks during ovulation after 2 weeks. It drops, it goes a bit up and then down just before menstruation. So this last week here, can you see my cursor? Or not?
Oh, yeah,
No?
that's visible.
Sorry?
We can see that. That's all good.
Oh, that's wonderful. So I can make a reference to the picture. That's great. So here all hormones drop down, and this is the last week before menstruation. That's the period when women with ADHD complain about severe increase of mood swings, anger outbursts, and all kinds of difficulties that I'm all talking about. Because women have told me for years on end that they suffer from premenstrual mood instability and also increased ADHD severity. And this varies from inattention, impulsivity, irritability, anger outbursts, depression, increased sleep disturbance, anxiety, panic attacks, even suicidal thoughts. And those symptoms recur every month. That's why it's a problem. And the efficacy of their ADHD stimulant medication seems reduced in that week just before menstruation. And women tend to call it danger week. Stay out of my way, otherwise I kill you. That's, for instance. So this puzzled me because if this hormonal drop is behind the symptoms in the premenstrual week, why wouldn't it also happen after giving birth and during perimenopause? Because the same hormones drop in that episodes. But there were no data to refer to or to base our thoughts on. So I asked myself the questions, are hormonal mood problems indeed more severe and more frequent in women with ADHD compared to women without, and that during the lifespan, so premenstrually, postnatally, and perimenopausally. In 2016, I was at a symposium on ADHD women in the Netherlands, and we asked the women in the room what research topic they needed to be studied first. What was their highest request and most needed subject that we should study for them? And they voted for hormonal mood changes during the life cycle. So for me, this was a moment that I realized that it was really something that we should address, that we should look at. So the next step was developing a questionnaire for 200 women at such a conference using self-report questionnaires in order to compare the symptom levels in women with compared to women with ADHD, without ADHD from the general population. And we indeed found a much higher levels of premenstrual dysphoric disorder, so the premenstrual depression, the postpartum depression, the PPD, and the perimenopausal symptoms, including depression. We replicated the same study in our clinic at PsyQ with 200 women, around 200 women with a diagnosis of ADHD. So they were carefully assessed. And this was the age range, and we used the same questionnaires. And we found that the premenstrual dysphoric disorder depression was 1.5 as frequent as in the general population. So 45% of women had premenstrual depression during at least 1 week. And also the severity of the depression was increased compared to the general population. the postpartum depression in the 85 women with children, 58%, so let's say almost 60, had experienced at least once a postnatal depression, which is very much increased compared to the general population where it's 19, let's say 20%, so it's a threefold increase. In the perimenopausal period, there were only 37 women, and also they experienced a threefold increased level of symptoms of anxiety, depression, and somatic symptoms. So there's definitely something going on that's different from women in general. So what we found was a 2 to 3-fold increase levels of premenstrual depression, postpartum depression, and perimenopausal mood symptoms in ADHD women in a clinical sample. These are 3 periods of hormonal changes during the lifespan. And what they have in common is the similar changes of hormones and especially drop of estrogen. So that's important to understand what's going on in order to think about treatment options and how we can help women with ADHD in this respect. But as I already told you, there's very little research on hormonal influences on the brain in women in general. And this is because women were excluded from all research in health, in medicine, because of the cycle, because the cycle induces changes every month, thereby influencing all kinds of processes and symptoms of all kinds of disorders and diseases. So mainly our medicine is based on male subjects. So we know, in fact, rather little, a few things about women, women's bodies, women's cycles, women's hormones. And this is even more true for ADHD women, as there are almost no studies on their hormonal issues. I think we are one of the first that did that. I looked into the literature to find an explanation for this increased severity of mood problems in those 3 episodes, and I found this. We know in ADHD there's a low dopamine level in the brain. At least that's what we suppose, because the medication for ADHD increases dopamine levels, leading to less symptoms and more control. Estrogen and progesterone, the female hormones, they act into the brain and they modulate neurotransmitters like dopamine and serotonin. Serotonin is involved in mood and anxiety. So they talk together in the brain. Those sex hormones also have been implicated in brain development and maintenance. And those hormones directly affect the brain regarding cognition, memory, learning, emotion, and influence reward-related motivation, impulsivity, and temporal decision-making. Well, anybody who is a bit involved in ADHD executive functioning recognizes these subjects, because this is exactly where dopamine is acting as well. So estrogen also influences the blood flow and metabolic rate of glucose, which is the dinner for the brain. And this estrogen influence changes during the cycle, leading to a changed blood flow and glucose metabolic rate in the brain. So it shows to me that estrogen acts like a neurotransmitter as dopamine and serotonin, although we call it a hormone. And we think that it's limited activity only on the ovaria of a woman, but it's also working actively and interacting with other neurotransmitters in the brain. So this is the new idea. For me, at least, it was a new way of looking into it. And I found more support for this hypothesis because estrogen helps to increase dopamine synthesis and stops its degradation. It upregulates receptors. It works especially in the frontal cortex here, where the ADHD symptoms often develop. It impacts working memory by affecting dopamine levels and so on and so on. It also works on the limbic region where emotional control takes place. So there's really an interaction between the neurotransmitters involved in ADHD, like dopamine, and this female hormone estrogen that's fluctuating throughout the cycle. Here, this is an important paper. Estrogen shapes dopamine-dependent cognitive processes, implications for women's health. This was a paper that helped me to formulate these hypotheses. And my idea now is that if you have ADHD and you have low estrogen in the last week before the menstruation starts, you are 2 times deprived of compounds that help you to control your behavior, your mood, and your cognition. So you're really stuck. You're deprived of any help to cope with those symptoms. So your ADHD may increase and your mood may deteriorate in this very last week. This was also confirmed in a study by Roberts in control women. So they did not have ADHD. They were young, they had a regular cycle, but they proved there was a relationship between the levels of estrogen and ADHD symptoms. And those symptoms were happening in women without ADHD diagnosis. And they found that the last week when estrogen is low, there was a higher level of impulsivity and inattention, which is compatible with the hypothesis I just mentioned. And they concluded that the stimulant response may differ across the cycle for that very reason. And this is exactly what women with ADHD complain about. They say in the last week of the cycle, the medication seems less effective somehow. And I don't know why, because I take it regularly, I take the same dose, but it doesn't work as well as in the first 2 to 3 weeks. Okay, this leads us to what we can do about it. Well, in fact, it's simple. It's a whole slide, but in fact, we say use hormones or use an antidepressant, an SSRI. Both have been proven to be effective, reducing symptoms in the premenstrual week of depression and anger outbursts and instability. Both are effective. And using contraceptives, it's important to understand that the stop week of the pill is inducing the symptoms again. So you should not have a stop week. You should continue to take the pill continuously. There's no reason not to. There's no medical reason not to. It's completely safe. So would be my advice. If you use the pill, skip the stop week and find out whether the symptoms diminish for you. An antidepressant for mood symptoms during the whole cycle, or maybe only the second half of the cycle, discuss it with your GP, can be effective. And what women with ADHD tell me themselves is that they experiment with temporarily higher dosages of the stimulant medication they have been prescribed. And they say it works. So this is also compatible with the hypothesis that you can influence the premenstrual depression and increased ADHD severity in this premenstrual week by either increasing estrogen using the pill or antidepressants inducing higher serotonin levels, I suppose, and or increasing dopamine levels using temporary higher dosages of stimulants. But the last one has never been studied, so I'm not sure. I just tell you what I know. Also be affected for perimenopausal symptoms. So it's not very different. I'm now going to the next chapter on health in general in ADHD and especially in women. But maybe there's a question on this first part. I cannot see any chats going on.
Yes,
please.
there are some questions.
Please tell me.
Someone was asking, can we also take more ADHD medication during this dark week?
Yes. Well, as I just told you, I hope you heard it. People with ADHD, women with ADHD, tell me that they take a slightly higher dosage in the last week before menstruation, and that it may be helpful to reduce the severity of mood and ADHD symptoms in that last week. But it's not been studied. So you should discuss it with your GP or psychiatrist, whoever is prescribing the medication to you, that you want to try out and that you should evaluate with him or her, because your prescription will be earlier finished than expected, and this could pose problems for you.
Yeah, okay, thank you. And then there was I think 2 sort of complaints about psychiatrists, and I know from experience here in the Netherlands about GPs who don't know this effect and are sort of dismissive or ignoring it, or telling their patients, oh, okay, you have to live with it, and those kinds of remarks. And what can a person, a woman in this case, do to inform, stimulate, challenge their psychiatrist or their GP?
Well, show them this webinar.
Yeah, someone already said that in the Q&A, yes.
Yeah. And there is a more extensive webinar of 1 hour, also by ADHD Europe on YouTube. And I use it to educate patients, but also colleagues, because the real truth is that this is very new information, at least in women with ADHD. But it has been known for ages that SSRIs and oral contraceptives continuously are helpful for premenstrual depression. So they should read the literature a bit better, I think, sorry to say, to my colleagues. But you need to keep learning in order to serve your patients well. That's my conviction, and that's what I try to do myself. But now I'm educating you to empower you to ask for the right help. So it may be true that you, at some point, know better than the doctor. And some doctors don't like that. But if they want to learn, they should listen to you, because they're not aware of the new developments. And it's very recent that we found that ADHD women do have a decreased rate of these symptoms in the episodes, 3 episodes in their lives. So maybe they missed this one paper. There's only one paper now. So don't be too hard on them, on the other hand, and try to get them curious and educate them.
Yeah, sure, of course. Well, at least I can give my testimonial that I learned it from you a few years ago, and now I'm more quick that I recognize it in women when they talk about these mood swings during the weeks, and then you can start addressing that, refer them to their GP, etc. So at least let's start recognizing it, and then of course you have to be a bit kind to your GP or psychiatrist, because many of them are quite behind. Well,
you should try to get people curious instead of punishing them for being ignorant.
Yeah, that's the right word. Yes, thank you. Yeah. Thank you. That's great. Okay, please proceed.
Okay, thank you. So this is about health in general for people with ADHD. We found in 2013 that people with ADHD have more physical symptoms and disorders compared to controls. This was also a questionnaire study, around 200 people with ADHD and 200 controls. And here you see that all disorders were more frequent in ADHD, and this was significant in all cases. So it was not only depression or stress, burnout, but also lung problems, cardiovascular problems, gastrointestinal, metabolic, immunological, and musculoskeletal problems. So the whole body seemed involved. And at that time, I thought, how can we explain that all organs are out of balance, it seems? And how can we better understand and prevent that? Now we are much further. It's now 2021, and this paper was recently published in 2020. It is a large Swedish registry study on physical conditions in adults with ADHD compared to millions of people without. And in this study, there were 4.7 million adults, and of them, 1.3%, 61,096, were diagnosed with ADHD in this register. In Sweden, the GPs keep a register of all patients, and this is a source of information and a wealth of data that we learn so much from, because when you look into such a large group, you're much more certain that what you find is really there. And what we found was amazing, what they found. They found that the adults with ADHD had an increased risk for most physical conditions they measured. And these were 34 of 35 conditions they studied. So almost all. This is not funny news. And here you see the conditions that they checked, and they were all more frequent in adults with ADHD. And this was all significantly. But the highest rates were for nervous system disorders, starting with sleep, another subject that I talked about for ADHD Europe, epilepsy, and sadly enough, dementia. But also respiratory disease like asthma, chronic obstructive pulmonary disease. And here are the odds ratios indicating how much more frequent these disorders are. The patterns were similar in men and women. There were genetic associations between ADHD and those physical conditions also in family members. So this is pointing to a genetic background of the comorbidity of the two. It's a similar result that adults with ADHD also used more medications for both physical as well as mental issues. It's logical. And they used more healthcare, of course. But this was increased in women. So this is gives a more clear overview which conditions have been shown to be more often associated with ADHD: asthma, obesity, sleeplessness, insomnia, chronic pain, burnout, fibromyalgia, chronic fatigue syndrome, smoking, intestinal problems with immunological background like Crohn and colitis ulcerosa, migraine, especially in the premenstrual week, teenage pregnancies, sexually transmitted disease, dementia, and PCOS, polycystic ovarian syndrome. It's quite a list. And I've been recently, my attention was drawn to the heart of women with ADHD. I met a cardiologist in the Netherlands who is specialized in women's hearts in general, and she told me that heart infarction is the #1 cause of death in women in general in the population. I wasn't aware of that actually. And she told me that women's heart infarcts have a different way of presenting. They suffer from coronary artery spasms instead of obstructive arteriosclerotic obstruction of the arteries. But both can lead to infarction of the heart muscle behind this artery. The two are difficult. This last one, the spasm, is temporary and therefore not visible when you make an angiography, so a heart film to show what's happening to the arteries of the heart. But now they can prove it, giving you a provocative, challenging test leading to spasms of this coronary artery. And if a woman then recognizes this, complaints that she suffers from it, which were never being shown on an objective angiography, the diagnosis can be made. So here's a picture of an artery obstruction. Here you see an arteriosclerotic plaque induced by high cholesterol levels, for instance, and all kinds of things like hypertension. And then this artery is blocked, and then you get an obstruction of this coronary artery. Whereas in spasm, there is nothing blocked, but only temporary narrowing of the vessel. This happens to occur more frequently in women, and it happens to be associated with stress, anxiety, and depression, leading to, as they suppose, inflammation, oxidative stress, endothelial dysfunction. This is the vessel of the heart. This is a different picture as compared to this obstructive disease. We all know that for heart infarction, there are several risk factors, such as having a family member with hypertension or cardiovascular disease, obesity, diabetes, cholesterol, smoking, and not moving enough, having a sedent life. The risk factors for the spasm disorder are the same, but in addition, there is migraine, having an abortion, not an induced one, but a natural one, having early menopause, thyroid problems, irritable bowel, hypertension, rheuma, and Raynaud. And what have these risk factors in common? It's all vascular. It's the vascular diseases. So when I learned about this, I wondered whether people with ADHD who have a lot of stress and often suffer also from anxiety and depression might be implicated in the spasm story too. The symptoms are quite different. In obstructive cardiac disease, there's chest pain after effort, extreme tiredness, pain between shoulder blades, shortness of breath, and restlessness and anxiousness or nausea. But in the spasm disorder, It's an erratic changing pattern of chest tightness, and it's happening also in rest, not only after effort. It's also happening at night, and it comes and it goes. And it may give a feeling as if your bra is too tight, or as if you're in a harness, or as if you cannot sigh deep, that you feel that you can sigh deep. So it's a different clinical picture, and it's changing all the time. So it's difficult to take it seriously. For many women, they say, it's gone. So I continue with my life. So I met this cardiologist. She's called Janneke Wittekoek. She owns a heart clinic for women in the Netherlands. And she heard my story on women with ADHD at a conference. And she said, the women you describe, I'm seeing on a daily basis in my office, in my clinic. I said, is that true? I wasn't aware of that. Please screen those women for me. Here's my screener. And she did that. And the first data are here. And you're the first to hear about it. So you're ahead of your doctor by far. It's not even published. So understand where we are. She had 42 women at the heart clinic with cardiac disease, and 50% of them screened positive on lifetime ADHD symptoms, which is a huge number. It should have been 3 or 4%, comparable with the prevalence in the general population if there was nothing going on. But there is definitely something going on. So we will further assess those women, and we will do more research into their cardiac condition. The other idea we have, and this is what Dora will introduce to you next, is that we developed a ADHD Women's Health Survey in which we address this cardiac symptoms and complaints. And we want to gather a lot of data of all women in Europe with ADHD who want to support this study, because it's empowering us to make better healthcare possible for women with ADHD. So please join our effort, because what we can learn from it, we gain knowledge and quantify the problem. We may develop treatment for women with cardiac disease and ADHD. And finally, and it's most importantly, develop prevention for all women with ADHD. So I would like to ask you, let's get started with number 1, gain knowledge and quantify the problem with your help. Here is the Women's Health Survey that you'll hear more about from Dora and Chantel. And I thank you for your attention.
Yeah, a nice bridge to the next speakers. Due to time reasons, that's why you can read below on the screen. If you have any questions, specific questions, feel free to email us. You can see the email address. And I would like to propose to proceed with Chantel, who will share about all the activities that we do from the women's group, including ADHD Europe. Thank you, Chantel. Thank you, Sandra, so far.
You're welcome.
Just give me 2 seconds because I'm having some technical challenges here. I think, is my presentation up, everyone?
No.
Just need to open, if you open your PowerPoint, Chantel.
It is open. Sorry, everybody. I did do a test and it did work just now. It's not coming up.
I can also go first if that makes it easier.
I'm saying entire screen and then the PowerPoint's not giving me an option.
Once you've shared your entire screen, just open the PowerPoint.
Okay. Sorry about that, everybody. There we go. It should show now.
Yeah.
It's showing video. Good.
There it is.
Okay.
Yep.
So,
go on.
How did this whole raising awareness about undiagnosed and diagnosed ADN women start? So there was a call from the European Federation of Neurological Associations under the Brain Life Goals, and we put in a proposal of which we were one of the 10 winners in 2020. And it was a non-profit partnership with ADHD Deutschland and ADHD ASC and LD Belgium. At the moment, the project is also moved over to ADHD Europe with all our European members, and we have a subcommittee group. So if you would like to join in on all the activities and discussions around Europe that we have together, please do look at ADHD Europe's website to become a member. So with this project in 2020, we decided to start raising awareness because, like myself, women didn't know they had ADHD. And one of our real main goals was to change women's lives. And I'm going to talk more about that a little later on. We wanted women to know that they're not alone. A lot of women and girls suffer in a lot of silence. So what were we doing? We were also motivating women to go and seek a diagnosis. We created a website especially for women. On our website, we have a lot of information to help anybody read, even for husbands, even for brothers, for grandmothers. It's all there. At the moment, it's in English and German, and we're busy with more languages. And because this project lifted off so much and our social media inboxes, we decided to open up a support group, which is held every 2 weeks, and it's run by ADHD coaches. So when we first started, we were using storyboards, and we were trying to use thoughts, because us women, we internalize things. We don't always speak to everybody about stuff. So a lot of women go researching online. They don't realize their symptoms are different to their brothers. And then they actually see that their symptoms are connected to ADHD. Also, some families don't support, or they don't know. They don't have the education about ADHD. And a lot of girls and women, they're pressured. They're pressured to try harder, and they struggle, and it becomes so difficult. We also decided to do storyboards on emotions, which was very well received on social media, because a lot of women, again, we don't talk about our emotions with everyone else. It becomes the guilt and the shame. And sometimes you avoid conflicts. You're scared of hurting others. Sorry, my kids are just running around, so I do apologize for the background noise. So from campaigning on social media to stories on our website, we were campaigning and asking women to share their stories. Currently, we have about 120 women signed up to share their stories. And I've told all those women, whenever you can, forward it through. Some ladies forget, some people are still busy, but we've received 26 in about 6 months, because it took us a while to build the website. But in 6 months, we have 26 stories, so that's really fantastic. If you want to share your story or join our newsletter, please email us, and we are more than happy to send you more information. You can either use your name. A lot of ladies didn't want to use their names, and a lot of other ladies said, yes, use my name. Please let everyone know about me. And women are really coming out about this. So as Dora mentioned earlier, we know that the diagnosis is girls 3 to 1, and with adults it's 1 to 1. And of course, girls present in a different way than boys. Some girls have inattentive type. It's not the story that, the girl's jumping on the boys are jumping on the table, the girl's not, so therefore how can she have ADHD? And then also, a lot of Sandra's research is normally during puberty is the main onset that girls are missed. So we do know girls are quiet in the classroom, teachers don't notice, and there's no assistance or help or support. So we also know, oh, shoot, what happened there? For a long time, girls and women were ignored in research and literature. And with thanks to people like Professor Sandra Coy, Sari Solden, Dr. Ellen Littman, Dr. Dora Wynchank, we are taking research to the next level, much needed. And we have so much women getting diagnosed much later in life. And the amount of lifetime struggles is absolutely enormous. For example, in our support groups, no names mentioned, but we have women saying, I finally found someone who understands. I finally realized that there's people all around the world, Brazil, America, Syria, Saudi Arabia, joining our support groups, that everybody is so interconnected with ADHD and the struggles and everything connected to that. And even tears, the women are releasing moments of joy for finally knowing what's been going on in their lives all this time. So we also know that the comorbidities in females present so much different to men. And we also know that the long-term outlook is much more severe. And women, because they tend to internalize all this negative feedback. And of course, let's not forget the hormonal involvement in the puberty and the menopause. I know Sandra did mention that earlier, but all our YouTube videos are just Google on YouTube, Broadcasting ADHD Europe. I am so impressed that this webinar, which was held last year, is almost on 15,000 views. So it's been really well received, and I'm sure it's been assisting many, many women with those questions. So I'm quickly going to talk about some gender role expectations. As we know, women have to watch the babies, feed the babies, watch the children, pick up the children, drop the children, feed the husbands. Some women work, never mind the dogs they have to walk, the cats they need to feed, and cooking and shopping. So we have quite a expectation from our husbands or from our families with all these things we have to manage, which gets a bit difficult sometimes, but we try, even though we forget some things, but we all try. So if women are struggling with undiagnosed ADHD, there's such a sense of shame to be able to do all of this. It gets embarrassing. There's so many emotions. I'm sure if there's some woman watching, you totally understand what I'm talking about. And of course, all these negative effects and so forth, they're so interlinked with comorbidities, the anxiety, the depression, and etc., etc. So I just quickly want to ask the audience if you can put in the comments, and Avilia, if you can just read them out for me. I'd like to know, how do women feel that have ADHD? I'd just like to pose a question out, because we've been listening to Sandra talking, Dora talking, just to wake everybody up before Dora comes to speak about the survey. Vilja, you with me? No.
Yeah, just waiting to see if you want to post something in the chat on Facebook or YouTube. I can bring your comment up on screen as well. Just be aware it will show your name, your face, and your comment. So feel free to make a comment. If you prefer it not be brought up on the live stream, just let us know. Here we go. First response is overwhelmed, free falling. Finally, I know what causes my problem. I was sad and happy. I feel most of the time like an alien. Someone has written.
Excellent. Some more. Come on, ladies. We feel lots of things. Men can jump in too. Any more, Vilja, or I carry on?
Overwhelmed, easily stressed. Not knowing was hard. worthless, sometimes inadequate. Overwhelmed comes up a lot.
Of course. We're always overwhelmed, yes. Okay, I'm going to move
feeling
along.
like a fraud. Yeah. I think
Yeah,
there's
I'm going to move
a lot
along.
of themes.
And the ladies are more than welcome to continue this in the comments, because I think it's quite a fun thing, in the sense that you're going to be reading some sentences that other ladies are saying, and it might resonate with you, and you're going to know you're not alone, and another lady or woman will be feeling the same way. So I've just got a few here. It might not be the same as everybody else. Disorganized, easily distracted, exhausted, lazy or tired, low self-esteem, mood swings. There we go with overwhelmed, problem with timekeeping, spending a long time to do something, and being unmotivated. Excellent. Let's move along. So I'm not too sure if Sandra or Dora have spoken about this before, but I realized the red flags of having ADHD when I was listening to a conference with Dr. Ellen Littman in 2017. And I'm not saying because you have these red flags, you have ADHD. I'm just saying red flags of having ADHD. So you get easily irritated. You're so hypersensitive. You feel like you're never achieving anything. You have this perfectionist behavior. Maybe that's why we take so long to do everything. Picking behaviors, this is quite a severe thing. It's not the playing with the hair and doing your nails. It's more of like really hurting yourself. A preference for carbs. Myself, I was very addicted to Coca-Cola, and I've actually moved over to bubbly water, which helps quite a lot. The rejection sensitive dysphoria. Those outbursts of rage, our moods. And then we have the chronic red flags, the anxiety, the depression, the sleep problems, the substance abuse, and the addictions, and the restlessness. So I want to quickly ask the audience again, with all these red flags that I was talking about, could you perhaps quickly write in the comments, because I'm probably running out of time, what do you think the consequences of all these red flags can be?
Your question about feelings is creating a tsunami of feelings in the comments.
Well, that's women. We have to talk.
Yeah, but it's
okay.
very...
Maybe I'll skip this question. Seems we're having a tsunami. Okay.
Yeah. I can testify that it's very informative for men also.
Of course.
And of course, and what you say is very good, to get the feeling, hey, I'm not the only one on this planet who has trouble surviving in family management during, and have a job and have kids, etc. So thank you for your
I'm not finished, Hans. So
but we are running out of time, so please
I'll be
run up.
quick now. I'll be quick. The good stuff hasn't come yet. So everybody's seen this on the screen, the consequences. So I'm not going to read through everything. So there we go. So we've been having peer-to-peer support groups every 2 weeks. It's a global network. Many women find their tribe, get support, share experiences. The outcomes is women understand, they gain more knowledge about their challenges, their symptoms, and we talk about strengths and strategies. Also, it's ADHD Awareness Month. ADHD Europe have partnered with ADHDawarenessmonth.org, and ADHD Women, with our subcommittee group in ADHD Europe, have been promoting Girls That Are Missed. It's on our website, all over our social media, and we're highlighting how girls are missed. We've got more coming. Actually, today I put on executive functions, and it was a tsunami on Twitter. Absolute tsunami. I've never had so many retweets and loves on Twitter in my life before. We have an ebook coming out about the burnout in women with ADHD. We have more information about high-functioning ADHD, and we'll also be spreading the declaration about ADHD in girls and women in many languages, because in many years on European level, not much has changed. So this is part of our advocacy work. Last but not least, ADHD women development. By sharing our knowledge and experiences between European countries, collaborating on awareness activities across the globe, working together to share evidence-based information. And I would like to reach out to anybody out there that would like to join ADHD Europe to visit our website and sign up. But I must let you know that ADHD Europe does not offer individual support. You would need to look at our members, which is also on our member page, to find a nonprofit organization in your country who can help you in your country, because diagnosis and treatment is country specific. Lastly, I'd just like to thank everybody for being so active and for joining us tonight. Thank you.
Thank you, Chantel. This was really wonderful and motivating. And I've been reading all the questions and remarks, and that people recognize what you say and what speakers Dora and Sandra have been saying. So, Dora, are you ready to rumble for the survey?
I'm ready. If you have my screen, I'm happy to start. Is everything on board? Good.
It's there.
Okay. So great. We've had fantastic responses in the comments and in the chat about people identifying with what Chantel has put forward. Now I'm going to talk to you about the newest insight on health in women with ADHD and shining a spotlight on a survey that you can participate and in fact you can form and construct yourselves. So this is the last part of the evening. I'm going to be talking to you about a survey for women by women that's going to be Europe-wide. And this is really going to take women out of the darkness in terms of the ADHD, and women who have ADHD themselves will be able to draw our attention and help shape what their experience is about. So I'm referring here to what Sandra mentioned earlier, the ADHD in Women's Health Survey. And this is your opportunity to contribute to novel scientific research and to have your experience heard. So there'll be a link in the chat where you can actually sign up and you can receive updates about when the survey is going to be launched, which is shortly. So why are we conducting the survey? Well, first of all, as you've heard over and over again, there is a lack of research focusing on adult women with ADHD. And the problem is that, as Sandra mentioned, just by being a woman until 1992, you were automatically excluded from pharmacological trials. So medicines were not researched in women because of the complicating factors of their hormonal cycles and the fact they might fall pregnant. So a lot of the drugs we use are in fact based on research findings from men. But more than that, it's the perspective of the women that we feel is so important. And this survey is going to give us the opportunity, with your help and with you spreading the message to people you know who have ADHD, we'll be able to collect the experience of thousands of women with ADHD living in our continent. Now, most of the research we have to date focuses on what caregivers like parents think, or guardians of children, or health professionals. But it doesn't ask people who have ADHD themselves, what is your experience? In addition, a lot of the studies have got small sample sizes. So we're looking at very small numbers of people, and we can't necessarily draw conclusions from small samples. And it's expensive to do research. Furthermore, many studies rely on medical records looking at, or registry studies, which are, of course, immensely useful, but they don't ask people living with ADHD, what do you understand by this issue? And they offer the perspectives of the researchers, which, of course, have a place, but we are interested in unpacking what women with ADHD feel and think. So this survey aims to understand the overall experience of adult women with ADHD and explore the links between ADHD and other health conditions. You've heard about some of them, cardiac health, hormones, but there are a number more. We want to know why there are barriers for women to being diagnosed. In the chat, I saw someone posting about poor facilities in Scotland, but I think this is probably true in many parts of Europe. So that might be one, but we need to know from you, why is it hard to get diagnosed? Why do you know more than the expert you are going to see? We want these women to identify future research goals. We want to be guided by the needs and the interests of the women so that we can construct appropriate interventions that are what women want themselves. So who's involved in the study? Just to tell you, you know 3 of us already. We have Bethan Burnside, whom you haven't met yet, but she's a PhD candidate living with ADHD and researching, and she's currently working at the Center for Medical Genetics in Belgium. We have Milène Bomer, who is a senior researcher at PsyQ, Center ADHD Expertise Center. We have Chantel, whom you've met tonight, of ADHD Europe. We have Carola Stivala, who was involved in a previous survey. Also, of course, we have the support of the board of ADHD Europe, Hans, and many others. There's Carola, and Chantal you've met and heard already. She's incredibly motivating. Then you have Sandra and I, who are both psychiatrists who specialize in adult ADHD at CQ. Okay, so who is the survey for? Well, it's for people who have ADHD, who have been diagnosed, who have diagnosed themselves, or in fact diagnosed by a health professional, people who identify as women as long as they are 18 years or more. What are we surveying? Well, there are 6 parts of the survey. The first is demographic information. The second is how ADHD is diagnosed and what kind of symptoms people have. The third is ADHD and other health conditions. The fourth is the menstrual or reproductive cycle. The fifth is sleep. And the final section is conflict in intimate relationships. So, first of all, demographics. The question is, what are we asking about? Who's filling in the survey? Well, of course, there's a spotlight on the age of people, where they live, but I think we are asking more interesting questions, like, for example, what is your sex assigned at birth, but what gender do you identify as? These kind of questions, and there are many questions, I'm just giving you a little sample, but these are questions that have not been studied previously. We ask about the country people live in, but we also ask about their ethnicity, their nationality. We ask them about their sexual orientation, and if you have a partner, does this person or do these people also have ADHD? Because that complicates matters. So that's just a sample of the demographic questions. Then, the way women with ADHD experience their symptoms, we want to know in which life domains do you feel your symptoms the most, and where do they cause you the most obstacle? Now, I've already seen quite a bit of that in the comments section, which was immensely helpful. Do you think your diagnosis is accurate? And what other difficulties were you diagnosed with? Psychiatric, neurological, learning before your ADHD diagnosis? Again, just tonight we heard and read the experience of people who were diagnosed with other conditions, which is so common. We want to know this clearly so we can present it to the healthcare workers and say, these women are getting the wrong diagnosis. We're asking women about barriers to receiving a diagnosis, getting the right treatment, and being taken seriously by medical health care providers. In terms of health, we're covering all symptoms, but one which I think is really interesting is, there's some links between low melatonin and certain types of cancer, which is connected to ADHD. But we want to know, do ADHD symptoms get in the way of going for a cancer screening appointment? Do you usually go? We want to know whether women have had more likelihood of being diagnosed with cancer. Is ADHD a risk factor for developing cancer through all sorts of routes and mechanisms? We're also interested in the experience of people with ADHD and COVID, and there's some studies already published in the literature showing that those with ADHD have more chance of developing COVID. Then, as you've heard Sandra talk about, the reproductive cycle, for example, hormonal issues, we're very interested in. Fifth area is sleep, and this is something that we have studied extensively at PsyQ and at the Kenniscentrum, but we are going to incorporate the Holland Sleep Disorders Questionnaire into the survey, which is 32 short questions identifying about 6 different sleep disorders, which are raised in prevalence in those with ADHD. Another very interesting area which has started to be researched in this country is conflicts in romantic relationships. And in fact, there are 20 questions about the intimate partner relationship. So these start from just how good are you at negotiating? I explain my side or suggested a compromise for a disagreement with my partner, and vice versa. Did your partner suggest a compromise to you? But then we go right through the gamut until forced sex and basically using force or even a weapon to force a partner to have sex. So either to be the recipient of this violence or to be the perpetrator. So we're interested in both sides of the story around intimate partner conflict. And then, of course, we're looking at physical and emotional aggression. We're also adding in and giving women a chance to add in, what do you think has not been researched enough regarding women with ADHD? What would you like to see changed in the healthcare system? We're giving you a chance to dream and to propose your changes. And we're asking what kind of interventions are missing for adult women. Now, I want to just say that it sounds like a lot, but the question and the survey has been written partly by women with ADHD, so it's immensely user-friendly. It's very clear. You can save your answers and come back at another time. You can spend as long or as little time as you want. It's, of course, completely confidential, and every bit of information that we get will be immensely valuable to us and to all of you and to everyone, in fact, in the field of ADHD, living with it, treating it. So I have basically come to the end. I don't want to take up too much time. I want to leave some time for questions. It's been a long evening, but I just wanted to show you how we're planning to shine the spotlight on women with ADHD in a way that is participatory and constructive and creative.
Yeah, thank you, Dora. That was really wonderful. And I think it's of a huge importance indeed that this is going to happen. I do have some questions maybe to clarify. I did notice that you are summing up the lists of questions. So I think it's about 350 questions that people have to handle if they submit and want to participate. Is there any other help for people who may find, well, a bit of trouble with answering questions? I'm thinking of the comorbidity of dyslexia is very, very high in ADHD. Is there a possibility, can you at least take it along as a suggestion that people can do it verbally with an assistant who helps them to type in the questions?
Well, let me answer that briefly. First, a good question. Thank you. First of all, I really don't want to scare people off, because with every question you have an option not to answer. And of course, if something doesn't apply to you, you skip the entire section. So you might skip 10 or 20 questions in one shot. So please don't feel that you're going to be inundated. It's very user specific. So depending on what information you put in, you get more questions that you can or might choose not to answer. So that's the first point. Second of all, in terms of accessibility, we are translating the questionnaire. It's Europe-wide, so we don't assume people speak English. We are going to be translating it into other languages. And yes, I mean, I think you've raised an interesting point about having assistants And that's something that we'll raise with our team and perhaps take further, like perhaps an interactive kind of experience. But we do not want to exclude people who might have dyslexia or other problems.
Yeah, so well, just take it along as a suggestion, and that brings me to the content of what you presented. I think you mentioned something about gender identity. Just to inform you and the public, since only 2 months, ADHD Europe decided to start a committee, and we call it the LGBTQIXYZ plus committee. So everything about sexuality, gender identity, etc. in ADHD population will be studied and promoted, and asking for input, stalking scientists to do something about it. Are you going to take gender identity along in your survey study?
Yes, absolutely. I think, Hans, you raise an important point. It's been neglected. It's becoming more and more topical. We need to explore these areas so we can represent everybody and not just, and we want to get away from this kind of mainstream heterosexual white man image. That's not what we're interested in. We really want to look more broadly at different ways that people live their lives.
Yeah, sure. We recognize that there are quite a few, also in my practice in the Netherlands for years already, quite a few women with ADHD who report that as a girl they were a so-called tomboy. And let apart the scientific background of that, that's an apart study, that's something else. But like Sandra Coy already mentioned, the ADHD can then be, or you mentioned it, sorry, I mix it up, that your self-esteem is then hurt because you will be thrown out of the group. You don't belong to the girls and you don't belong to the boys. So there you are alone in the schoolyard, and your loneliness is inflicted for the rest of your life. So I think that's of a huge importance to take it along, referring to women. So I think we are, whilst we look through the questions, maybe Sandra or Chantel or Viljo, you have something to add to all the content that has been coming out today?
I think most importantly, Hans, that, this is a great opportunity to get involved into shaping some really important scientific research. And I've seen in the comments people offering to help the translations, people offering to answer the survey. We've got the link to take part in shaping the survey running across the bottom of the screen, and it's also been posted in the YouTube and Facebook comments. So please submit that form, get yourself involved in it. And I've also put in the links to the ADHD Women Project, which Chantel's been running. So you can check out the social media, the website, everything is in there, and that's in our YouTube and Facebook chat. So go check that out. They've been doing a fantastic job.
I have one thing to add, Viljo. Could you please add the paper on this hormonal mood changes during the lifespan that we published? There were some questions about it, where to find it, and it's
absolutely available. I'll find the link.
The link, I think. Yeah,
I'm sure it'll be somewhere. Let me check my email.
Can I just also, quickly answer?
Yeah, go ahead.
There's a question, is it okay for people with autism and ADHD complete the survey? Absolutely. So having comorbidity is no limitation at all. So if you have the ADHD diagnosis, whatever else you have, of course you are welcome.
Yeah, thank you. And then maybe something, also a suggestion for researchers like this survey that will be started. As a coach, I feel responsible for what it does to people if you open up this box of Pandora, I think it's called, the bottle of Pandora, whatever, because here's a story of a person talking about narcissistic abuse of an ADHD woman, and I've had some clients who have experienced that. That's hugely complicated. So if, Dora, if you start this survey, are there, and for you also, Chantel, if you start this community, are there also channels to refer people to help? Because when you're talking about it, it might blow in your brain, and then people, I feel responsible that we also offer at least referrals or first aid or whatever. I think that's very important. Dora, Chantel, can you respond to that?
Well, I'll speak in one sentence, and the answer to that is yes. We have Chantel, who offers a wealth of support. So I'll hand to you.
Oh, that's...
Chantel, go ahead.
Well, Vilja, if you can just pop in our email address, and you can contact us. Oh,
it was already there, the email address, yes.
There we go. And we'll help you as much as possible, even if it's directing to an organization, giving you the link to the next support group meeting, and especially sign up to our newsletter, because a lot of women, we forget things, and we send reminders, and we give replay links and information that you can share with your friends and colleagues and family.
I just want to say very briefly that we will be starting on a relationship with these women who join up for the service. So they will get, if they want it, only if they want it, they will get some feedback about what we use their information for and how we hopefully change policy. So it'll be a conversation.
Great. So, well, okay. Now I can rest assured and will have my sleep later on. Otherwise, it would keep me awake. Yeah, because we are responsible professionals, so we want to really apply to, well, I'm reading all these questions and my coaching heart is going, okay. Anything else? Last word from Sandra, Chantel, Dora, Viljo, anything?
Sandra, do you want to just pop that link in our chat so I can put it out to everyone, because I can't find it?
Yeah, I think you have the whole paper, don't you, the PDF? I sent it the last time.
It's got lost in my inbox. Is there a link to it?
I'll send it anew, but I just couldn't get into the website while I'm in this meeting. So I'll send it later to you. You can put it on the website.
Yeah. What we can do is we can put it on the ADHD Europe website, or we can email it out, a link to it out to everyone who's registered for the webinar. Yeah. So if you have registered, you'll be able to receive it, and otherwise we'll make sure it's put on social media so you can access that.
So, okay, thank you. Everybody can send an email if you have specific questions about where you can find all these papers. That is info@adhdeurope.eu. Thank you very much, Sandra Coy, Chantel Fouche, Dora Wynchank, and Viljo and I are very happy to have done this today. So see you in our next webinar. That is next week on Thursday, and you will be stalked with emails about it. Okay.
Thank you for organizing this wonderful meeting, Hans and Viljo and Chantel. And we're looking into a brighter future with the help of everyone. Thank you.
Thank you. Have a good evening.
Thanks, everyone. Have a lovely evening.
Bye-bye.
Bye.